Namaste to all, this is Shakti. In my today's video, I'm going to talk about carpal tunnel syndrome or CTS. Now what is CTS? What is carpal tunnel syndrome? Carpal is a bone in your wrist and tunnel is that space where all the nerves coming and joining at this place and from here distributing in your entire palm. You can see in this picture where the median nerve, which is shown in the yellow color, this nerve is coming from the neck, the sides of your neck, cervical bone. From that it is arising in your arm, further down to your wrist, and from wrist to distributing in your thumb, in your index finger, middle finger, and half of your ring finger. Now if you see, when this nerve is pinched or blocked, then we have a tingling or numbness in the hand. If you see this yellow nerve, which is called median nerve, if this nerve pinched or squeezed somewhere, then you have a tingling or numbness in your hand, which is called carpal tunnel syndrome. Generally people say go for the surgery, but we say before you go for the surgery, try 2 to 3 months some natural healing process where like you can take the yoga therapy. So how you apply yoga therapy in carpal tunnel syndrome situation? So before going for the surgery, you should give it a try to these holistic healing approaches like yoga therapy and acupressure therapy. So in this video, I'm going to tell you few yoga exercises for carpal tunnel syndrome. So if you practice these exercises 2 to 3 months, then only you decide for surgery if it is not okay. But you should give it a try to holistic healing approach for a few months before going for the surgery. So let's get started. So before I start, I'll explain about 2 places where the disease arises. One, the symptomatic place where the symptoms are happening, numbness and the tingling, and the second is root. So for carpal tunnel syndrome, root is here. So when you see there are cervical spine, cervical vertebrae, C1 to C7. So if there is some pinch is happening, there is any nerve is pinching, so you will have all the pain radiating from your arm to your wrist. So what you need to do? We need to work both on the root and the symptoms both, and more on the root. So when the root is here, so we start first on the symptom, then the root, because first you need to ease your hand to work on the root. So first we start with the hand. So where you take your palms like this and you breathe in up, you breathe out down, breathe in up, then down, up and down. Maintain Ujjayi breath, hissing sound through the throat, especially during the exhalation. So do couple of rounds here, 5 to 10 rounds. In the last round you hold, breathe in up, hold 1, 2, 3, 4, 5. As you breathe out, hold down 1, 2, 3, 4, 5. Now second one, you make a fist where you take a thumb inside, 4 fingers dropping, and you're gonna breathe in and breathe out. 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 5 to 6 times, then reverse. Make sure you're adding the breath in everything, because breath is the thing which helps in healing. So if you do the breathing with the movement, then healing is very fast. So after this, you relax your arms. Take 5 to 6 deep breaths. Relax yourself. After this, we are going to start working on the both symptomatic place and the root place. So you interlock your fingers, you're gonna breathe in and stretch your arms up. So what is happening here? Cervical spine to the wrist, you're getting the stretch nicely. So be in this stretch, close your eyes, 10 deep breath. After working on this, after 10 deep breath, you slowly exhale and relax. Now next we start working on this part where is nerve pinching is happening or the cervical spine. So I'm going to show you few stretches for this. So first you breathe in. As you breathe out, you're going to drop your right ear to the right shoulder. Hold. Feel the stretch at the left side of your neck. Maintain this stretch up to 30 seconds. Make sure your breath is normal. You're feeling the stretch. Connecting your mind to the stretches. You can hold up to 30 seconds to 1 minute. And you breathe in, come to the center. Breathe out, drop to the left side. And hold, feel this side, the stretch. And come back. So suppose if you have a pain, numbness and tingling in this hand, which is left hand. So you're going to drop your head right side and you're going to feel the stretch here nicely. So this is one thing, but if you have a pain at one side, so don't do one side exercise, always do both sides to equal it. Because if you do one side, the other side will be imbalanced. Here when you inhale, exhale, drop your right ear to the right shoulder to stretch the left cervical spine. Now then you raise your hand and take your palms in upward direction. And you're going to drop your palm down and hold this position for a minute. 1, 2, keep your breath normal. 3, 4, 5, 6, 7, 8, 9, 10. Then slowly take your head up and hand back and slowly down. Now same way we'll do other side. So what you do here, you're going to inhale, and as you exhale, you're going to take your left ear towards the left shoulder and going to raise the arm up, facing upward direction, dropping the palm in downward direction, maintaining the stretch, maintaining the breath normal, holding for 10 count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you come back slowly, relax. Now for the fifth stretch, fifth yoga exercise, you need to join your palms like this. So make sure your wrist and the elbows in one line, like this, and slowly you're dropping your wrist little down and elbows little up. Like this. You're going to inhale here, then exhale, relax, inhale wider, exhale, relax, keep doing up to 10 round. Inhale, exhale, inhale, make sure you're taking your wrist little down from your elbow level, and exhale. Inhale, exhale, inhale, exhale. You can do up to 10 rounds initially and relax. These are the 5 yoga stretches you need to do every day, 3 times a day. If you have a lot of pain and tingling and numbness in your palms, you can repeat it 3 times a day and keep yourself little empty stomach so you can breathe in and out properly. And now I'm going to tell you a few acupressure points for this problem. So as per the Sujok acupressure, your wrist point is this, the first joint of your finger. So suppose you have a pain in your left hand, so you take your left hand up and you're going to work on this joint, which is your wrist joint. So we are going to stimulate this point by massaging it with the probe like this. Massage it. So this is one way to massage this point. Another way, I have a ring. This ring you can wear here and you can massage. This is an acupressure ring, or you can wear it for a while here and leave it for a minute, or you can just keep on massaging on this point like this. If you don't have a ring, you can use anything. You can use any pen to stimulate suppose I have this pen. You can use this pen to stimulate this joint, which is the first joint of your index finger, the hand which you have a pain. As I said, for any problem, we have two places to treat, where like the symptomatic area and the root area. So symptomatic area, I said this is your wrist point, so you are going to massage this, you are going to stimulate it for a minute. And the root area, which is your neck, cervical spine. So if you bend your thumb, you see from this point where you're bending till this point, this is your C1 to C7 cervical area. So if you see this area, I'm going to mark it with the sketch pen so that you can see. So the joint which is joining here from here, this is your cervical area. Stimulate this point with your palm for a minute. You can close your eyes with a smile. You can massage it, sending the positive vibration, stimulating the point, channelizing the energy in your neck area where you have a pain. So while massaging, you do your smile meditation. With a smile, with a positive energy, you are healing your area of your pain. After massaging for a minute, the second thing what you're going to do is, I'm going to take a tape here. Any tape you can take. This is a micropore tape, paper tape. So on this you put some fenugreek seeds, which is, we call it methi dana. So on the fenugreek seeds you're going to put, and you're going to put this on the symptomatic area, which is your wrist, the first joint of your index finger. Put it here and let it be here for 6 to 7 hours. Second one you are going to do on your root area. So what is your root area? Is your cervical spine. So you are going to take a little big tape, and I'm going to show you. So this is how you're going to put the methi seeds on little big tape area, and you're going to put it on your full cervical spine like this. And you're going to leave it for 6 to 7 hours. So you need to repeat this treatment, the yoga therapy stretches and the acupressure therapy. Every day you need to do 2 to 3 months. And if you feel the symptoms are getting less, you're getting relief, do not go for surgery. You will get 100% relief with these therapies, yoga therapy and the acupressure therapy. But you have to have little patience. Like if it is chronic problem, it might take 2 to 3 months. But if it is not chronic, it will be cured within a week only, within a week or 2 weeks probably. So you wait for some time and try these holistic healing approach on your pain area. So that's it for now. See you in the next video. Thank you.